Welcome back. You're watching CHA Today. I'm your host, Jennifer Gallman. We are talking with Liz Clasen-Kelly and Mike Clement about the results of the recent study on the chronically homeless in Charlotte. Now, Mike and Liz, we've talked a little bit about what the study was to do. Let's talk about the results. What did you find out after 3 days in the field talking with people on the streets?
Well, as you mentioned earlier, we had estimated that there were about 600 chronically homeless folks. And what we found was 807 folks who are chronically homeless.
Wow.
And we know that there's a few people that we missed, but we feel like that's a pretty comprehensive, it was a pretty comprehensive study. Of those 807, we found 388 had at least one factor that made them vulnerable to dying on the street. And so that was sad. It's sad in the sense that there's 388 people who could die on our street. It's hopeful also that it's 388 folks. That's a manageable number. That's not 6,000 or 8,000. This is 388 people who we could focus on and make a real difference in their life. And of those 388 folks, we found 54 were over 60. We found 61 were veterans of the military. We found that 11 folks were under the age of 25. All in all, there were 46 people under the age of 25 who met the definition of chronic homelessness.
Oh, wow.
And almost half of those had some experience in foster care.
I remember reading that I think there were a few of the individuals under 25 that had been on the street for at least 7 years. Mm-hmm. So that's basically since they were 18 years old.
Mm-hmm. There had been some folks who'd actually been homeless even before they were 18. And so, you know, we can do better as a community, but what we have now is the data to say, here are specific 7 individuals, young adults, who we can target, who have some real issues. You know, clearly, if you've been homeless for 7 years, when you're under 25, you've got some real issues. You've had a real lack of stability in your life. But also, we know that there are solutions out there. We know that we could make a real difference in their life. And so what we're able to do with this information, it's not just numbers. Now we know names and faces and where folks frequent. And we know that there's existing resources out there, and we know that we need to grow those resources as well. But how do we connect those existing resources to the folks? You know, one of the interesting things we found is that half of the folks identified the emergency room as their primary source of getting health care. Where do you go when you get sick? Over 50 folks said the emergency room. We had over 1,000, those 800 people had over 1,000 visits to the emergency room in the last 3 months. And that's a cost to all of us in the community. That's not, you know, just the cost of the hospital. That's a cost to all of us. And so we know that there's real inefficiencies by having these folks out on the street for so long. And we know, again, that there are solutions out there. And so More Place, the urban ministry's partnering with the Housing Authority, is one piece of that solution. That's going to be housing for 85 folks. But we have another 300 vulnerable folks on our street that we need to create options for.
And More Place is going to focus on the chronically more vulnerable individuals that were surveyed. Mm-hmm. But like you said, that 85 was?
85, yeah. And so we'll actually take the vulnerability list and say, who are the most vulnerable folks, and we'll invite them to More Place.
That is a question when you mentioned how many times someone has been in the emergency room, the community at large. We do have resources, but there are some limitations to the amount of resources we have. So where do we put them? How do we best serve the entire community? And the impact on the health care is something that the community is paying for also. So the survey seems to have identified that, you know, if we invest the resources in helping stabilize families, that it will take away the amount of resources we need in other areas that we're currently putting them. So maybe if we more effectively wrap our arms around individuals and provide fellowship and support to get people stabilized, then there won't be so much reactive resources needed in the community. Mm-hmm. Mike, do you feel the same way about the results and what you've seen?
Absolutely. But part of the business case that was developed for More Place clearly spells out that it is more economically effective, Liz was mentioning this, to house the chronically homeless and make sure that they have the services to keep them healthy than it is to pay for those services in emergency rooms when they are ill and when they are not well. So we know, you know, if your only motivation to think about the chronically homeless is the economics of it, we know that housing is a better answer. I think that's part of what you're asking is, why should we care? So that's one reason. In my faith, we care about the least of these. And what I have seen and observed in dialogues that I've had around homelessness is that oftentimes we focus on the people who are most likely to achieve. In other words, we want to invest in people who can break through and be self-sufficient. I think all of us know that that's not possible for every human being. And so we have an opportunity now in our community with the data that's been provided to chunk that data up into manageable parts. You heard veterans, you heard the elderly, you heard youth, and focus on each group to make sure that they can have housing. So again, whether your focus is economics or whether it's the right thing to do, we now have the information, I think, to really move forward and make sure that the chronically homeless do have a roof over their heads. They do have a safe place to live and sleep and eat and prosper. They can prosper too.
Well, there's definitely seems to be a lot of community will for this issue and ending it for the city and the county. And we've invested some of the resources to analyze data for this specific segment of the population. So now we're looking at next steps. Can you tell us what are the next steps, or if people want more information or to learn how they can help, what they can do to get involved?
Yeah, right now we're looking at what existing resources we have and how do we connect the most vulnerable folks to those resources. So we're working with the VA. The VA has a housing voucher, so we're working to connect some of our vulnerable veterans with that voucher. We're looking at other things that exist. So that's one step. Then the second step is to say what needs to exist. And so then we're talking in partnership to say what new community resources could we create to have supportive, stable environments for the chronically homeless. So that's the next step. And there's a ton of different ways to get involved for folks interested in advocacy. There's advocacy, but we have 3 folks already from the list of 807 that are moving into apartments. So another way to get involved is help someone who's moving into apartment get their dishes together, get sheets for their bed, things like that. But anyone who's interested in volunteering and working on this can go to the Urban Ministry Center website, www.urbanministrycenter.org. You can contact me, Liz Clasen-Kelly. Kathy Izzard is also very involved in this, and we'd love to have your help.
Well, I want to thank you both for being on the show today. I had an opportunity to talk about this survey at Quips Cafe, and I met 2 of the owners there, and they wanted to extend to both of you a free lunch on them for the work you're doing in the community. So if you get an opportunity, stop on in, tell them Jennifer sent you, or take a friend and pass this along to them and give them lunch on you. So thank you both so much for coming on the show today.
Jennifer. Appreciate it.
Once again, to find out more about the survey results or the Urban Ministry Center, log on to urbanministrycenter.org. The Housing Authority and Salvation Army are partnering together to end homelessness for some families in Charlotte. Find out more when we return. But first, find out how the Housing Authority is moving forward. Back in a moment.